You've probably been told the same thing everyone gets told. If you're waking up at night to pee, it's your prostate. Maybe your doctor said it. Maybe your brother-in-law said it with total confidence over dinner. I believed that for a long time too, until I actually looked at what's going on with people who wake up 2, 3, 4 times a night. Here's the first thing that surprised me. Plenty of them have a perfectly normal prostate. One man was in his 30s, no prostate issues at all, and he was still up 3 times a night, exhausted, blaming himself for drinking too much water. Another was a woman in her 60s, and no one had even mentioned her prostate to her because she doesn't have one. And yet there she was, wide awake at 2 a.m. every single night. The real danger isn't that you might have a prostate problem. It's that it's your prostate becomes the answer nobody questions, while the actual cause goes untreated for years. I spend my time helping people understand what's actually happening in their bodies, especially the stuff that gets waved away with a one-line explanation. If you're here, my guess is you're tired. Not just tired from being up at night, tired of not getting a real answer. What I want to hand you today is a way of thinking about this that actually holds up, so you can walk into your next doctor's visit and ask sharper questions instead of nodding along. If that's useful to you, stick around. And if you want more of this kind of breakdown, subscribing just helps this reach the next person lying awake wondering what's wrong with them. Think about a smoke alarm going off in your kitchen. Most people's first instinct is to yank the battery out, because the beeping is the problem. But the beeping was never the problem. It's a signal. Something is producing smoke, and the alarm is just telling you. Waking up to urinate at night works the same way. The bladder isn't malfunctioning for no reason. It's signaling something upstream, and that something could be a dozen different things, only one of which is the prostate. Nocturia, which is the medical term for this, becomes far more common as people get older, and by the time people are in their 60s and beyond, a large share of them are dealing with it regularly. But here's the balanced part, because I don't want this to sound like a scare video. Waking up once a night occasionally is not automatically a red flag. Your body isn't broken because you got up once to pee. What matters is the pattern, the frequency, and what else is going on when it happens. The first thing worth understanding is overactive bladder. This gets recommended as a diagnosis a lot because it's common, and there's a real reason for that. The bladder muscle itself can become more sensitive over time, contracting before it's actually full, sending an urgent signal when there's not much urine there at all. The upside of knowing this label is that it's genuinely treatable with behavioral changes and sometimes medication. But here's the part that surprises people. Overactive bladder isn't really about how much urine your bladder can hold. It's about miscommunication between your bladder and your brain. People picture a bladder that's physically small or weak, when really it's a signaling problem, like a doorbell that rings before anyone's actually at the door. The nuance here matters. If this is your cause, the fix usually isn't hold it longer, which can make things worse. It's often bladder training done gradually, alongside looking at what you're drinking and when. The next time you see a doctor, ask them directly, could this be an overactive bladder pattern rather than a volume problem? And if you've ever been told to just cut back on fluids without anyone explaining why, tell me in the comments, because that's more common than it should be. The second cause worth knowing is simple timing of fluids. And I want to be honest that this one sounds almost too basic, which is exactly why people dismiss it. Your kidneys don't just filter constantly at the same rate all day. They respond heavily to when you drink, what you drink, and how your body redistributes fluid when you lie down. A lot of people drink most of their water in the evening because that's when they finally sit still long enough to remember to hydrate. The gut punch here is that the problem often isn't how much you're drinking overall, it's when. Someone who drinks the exact same amount of water but shifts most of it to the morning and early afternoon can cut their nighttime trips significantly without changing their total hydration at all. The alternative isn't drinking less water, because dehydration causes its own problems. It's shifting the timing and being honest about hidden fluids too, things like soup, ice cream, or that one glass of wine that's actually diuretic. Ask your doctor or track it yourself for a week. What time are you drinking most of your fluids, and does it cluster after 6 p.m.? If you've ever tried cutting off water at night and it didn't help at all, that's worth telling me about, because it usually means the cause is something else entirely. The third cause, And this one gets missed constantly, is sleep apnea. This gets underdiagnosed because people assume nighttime urination is a bladder story, when it can actually be a breathing story. When your airway partially closes during sleep, your body reacts by producing more urine, partly because of hormonal shifts, and partly because of the stress your heart and lungs go through trying to compensate. Research on sleep apnea patients has repeatedly found nighttime urination as one of the most common overlooked symptoms, often more common in that group than in the general population. The reframe here is important. People think snoring is just an annoying nighttime sound. It's actually one of the more reliable warning signs that your body is being interrupted at a level that has nothing to do with your bladder at all. If you've been treated for an overactive bladder for months with no improvement, and you also snore, wake up groggy, or your partner has mentioned you stop breathing at times, that's worth raising directly. The nuance is that not everyone who snores has sleep apnea, and not everyone with nocturia has sleep apnea either. But it's a connection almost nobody brings up first. Ask your doctor plainly, could a sleep study rule this in or out? And if a partner has ever told you that you gasp or stop breathing at night, that's genuinely worth mentioning in the comments, because a lot of people brush that detail off as nothing. The fourth cause is blood sugar. This one matters because when blood sugar runs high, whether from diabetes or from blood sugar that's edging toward that range, the kidneys pull extra water into the urine to help flush out the excess sugar. People upright assume nighttime urination is purely mechanical, a bladder thing, when for a meaningful number of people, it's actually a chemistry thing. The gut punch reframe is that increased nighttime urination can be one of the earliest visible signs that blood sugar is drifting upward, sometimes before anyone's had a fasting glucose test that catches it. This doesn't mean everyone waking up at night has a blood sugar problem, and it's not something to panic over, but it's a cheap, simple thing to rule out. If you haven't had a fasting glucose or an A1C test in the last year, and you're dealing with regular nighttime urination, that's a specific, reasonable thing to ask for. The fifth cause is heart-related fluid redistribution, and this tends to affect people more as they get into their 60s, 70s, and beyond, especially with any history of heart strain. During the day, fluid can pool in the lower legs, especially if you're sitting a lot or have any circulation issues. When you lie down at night, gravity stops working against that fluid, and it redistributes back into your bloodstream, which your kidneys then have to process, which means more urine production overnight. The reframe here is that this isn't about how much you drank. It's about where the fluid was sitting all day and where it goes once you're horizontal. This is one of the more balanced points in this whole list because it's genuinely more common with age and isn't something to be alarmed about on its own. But if you notice swelling in your ankles or lower legs by the end of the day, that's worth mentioning specifically because it connects directly to this pattern, and it's one your doctor can actually do something about. Now let's talk about what you actually do with this. First, ask your doctor whether they've considered ruling out overactive bladder, sleep apnea, and blood sugar, specifically, by name, rather than defaulting straight to a prostate explanation, because naming the possibilities out loud tends to get a more thorough answer than a vague, why am I peeing so much at night? Second, ask whether a bladder diary would help, because a few days of writing down when you drink, how much, and when you urinate gives a doctor actual data instead of a general impression. Third, ask directly what your last fasting glucose or A1C reading was, because that number is often already sitting in your chart from a previous visit, and nobody mentioned it to you. Fourth, ask whether your current medications could be contributing, because certain blood pressure medications and other common prescriptions are diuretics, and timing when you take them can make a real difference. Fifth, if you snore or have ever been told you stop breathing at night, ask plainly whether a sleep study makes sense. On the action side, start a simple fluid and bathroom log for just 3 days, noting time and rough amount for anything you drink, and when you get up at night, because most people are shocked at how much of their fluid intake clusters in the evening once they actually write it down. Shift the bulk of your fluid intake earlier in the day, rather than cutting total intake, since dehydration brings its own problems. Check your ankles at the end of the day for swelling, because that single visual check tells you something real about fluid redistribution. Look at your last 2 years of blood work if you have access to it, specifically glucose numbers, before you even go in for a new appointment. And if you take any blood pressure medication, ask your pharmacist or doctor what time of day it's meant to be taken, because this detail gets skipped constantly. Now, some warning signs and how this gets explained to you. The first is when "itch your prostate" gets said within the first 30 seconds with no questions asked about your fluid habits, your sleep, or your other symptoms. That's a shortcut, not a diagnosis. The second is when nobody asks whether you snore or feel tired during the day, because that question alone can point straight at sleep apnea. The third is when the only advice given is drink less water in the evening, with no explanation of why, since that's a partial fix being handed over as a full one. The fourth is when blood sugar isn't mentioned at all, especially if you haven't had recent blood work. The fifth is when medication timing is never brought up, even though it's one of the simplest things to adjust. None of this means your doctor is doing something wrong on purpose. Most primary care visits are short, and nocturia has a long list of possible causes, so it's genuinely easy for a rushed appointment to default to the most familiar explanation. This isn't usually personal, it's structural, a symptom of how little time doctors are given per patient, not a sign that anyone's being careless. What good actually looks like is a doctor who asks you a handful of specific questions before offering an explanation. They ask about your fluid timing, your sleep quality, whether you snore, your recent blood work, and your current medications before landing on a cause. If there's one line worth remembering here, it's this: the right answer to "why am I peeing at night" is never obvious until someone actually asks what else is going on. I don't want to leave you thinking this is all bad news, because it isn't. There are genuinely good developments here. Bladder diaries and simple tracking apps have made it much easier for people to walk into an appointment with real data instead of a vague complaint. Sleep studies have become far more accessible, with at-home versions that don't require an overnight clinic stay. And treatment for overactive bladder has expanded well beyond medication, with behavioral training programs that work for a lot of people without any prescription at all. Picture someone in this exact situation. Call him a man in his late 50s, waking up 3 times a night for over a year, who'd been told twice that it was just his prostate, given a prescription that didn't change much, and told to be patient. What actually turned things around was a 3-day fluid log his sister suggested he keep, which showed almost 70% of his fluid intake happening after 7 at night, mostly out of habit, not thirst. He also mentioned, almost as an afterthought, that his wife said he'd been snoring louder lately. That offhand comment led to a sleep study, which showed mild sleep apnea nobody had considered. Between shifting his fluid timing and starting treatment for the apnea, his nighttime trips dropped from 3 to about 1 every few nights. He said the hardest part wasn't the treatment. It was realizing he'd spent over a year assuming something was simply wrong with him that he had to live with. Here's what I need you to understand from his story. The label you're handed first is not always the real cause, and it's worth asking one more question before you accept it. So here's where that leads us. Overactive bladder is often a signaling issue, not a capacity issue. Fluid timing matters more than fluid amount. Sleep apnea is one of the most overlooked causes of nighttime urination. Blood sugar can show up first as a bathroom trip, long before a diagnosis. And fluid redistribution from your legs is a normal part of aging that's still worth mentioning to your doctor. The bigger idea underneath all of this is that nighttime urination is a signal, not a diagnosis in itself, and it deserves a real conversation, not a one-line explanation. This isn't about panicking over a symptom or assuming something is seriously wrong. For a lot of people, the fix is simple once the right cause is identified. So tell me, in the comments, which of these 5 did you already suspect, and which one caught you off guard? And if you know someone who's been quietly exhausted from getting up all night, send them this, because they've probably heard the prostate explanation too, and never gotten a second opinion. Take care of yourself, get some real rest, and I'll see you in the next one. This video is general information based on common patterns, not a diagnosis for your specific situation. Everyone's body and health history is different, so please talk to your own doctor about your symptoms before making any changes, especially around medications, fluid intake, or new supplements. Thanks for watching.